we talk a lot about the specific effects on the nervous system and how those effects may relate to medical treatments, how they relate to addiction, how they relate to feeding, how they relate to driving and sensory motor skills. And so that's most of the behavior that the class covers.
Okay, and so the bill does talk about medical cannabis use, and so talk about the studies that you found when it comes to, because this doesn't necessarily treat anything, correct?
Yeah. So the medical data are complicated, but also not great. So for behavioral and psychiatric illnesses, there are problems using cannabis to treat and THC to treat mood disorders, because mood disorders can have some apathy associated with them, and cannabis can exacerbate those, so it can increase apathy, and so that's problematic. For other psychiatric things, it's not great. It can cause, or some people suspect that it may trigger symptoms of psychosis, and that may interact with adolescents. And so it pretty much, if there's a history of psychosis in your family, advised not to use recreationally. And then for some other things, as an analgesic, some people have talked about using it as a treatment for pain. And it's not as addictive as, say, like opiates would be, but it also isn't as effective at treating pain. It treats pain in some unconventional ways. It sort of blunts some of the processing, or some of the relationship between emotional centers in the brain and somatosensory centers, places that are processing sort of like where the pain is versus how much it hurts. And so it tends to treat pain that way. So the people who take it for pain, it's not always working for them. And then, so you see, what's the other medicinal use that we discussed? Oh, it's, I assume you can edit this, right?
Yeah,
okay. It's an occupational hazard where I'll just keep going. There's another medicinal use that people have talked about in terms of using it for migraine. And migraine is an interesting one because we're not sure what causes migraine exactly. The science is not in on migraine causes, and so medications are sort of widespread. There are a lot of different medicines used for migraine, and so there is some evidence, some case study evidence, that THC and cannabis can relieve symptoms of migraine for people who are suffering from migraine, and nothing else is working. A similar kind of thing is true in epilepsy, especially with kids with epilepsy. The studies that have been done, the case studies on epilepsy, people have tried like 7 different medications and different diets to manage seizures, and it's not working. One study I saw, they had managed, or they had looked at, on average, about 12 other types of medication or treatment for their epilepsy, and it wasn't working. And about 80 or 90% of the kids were showing a reduction in seizures and in severity as a result of the treatment with cannabis, and they were taking like a cannabis extract. So when they're giving it to kids in these studies, it has a low level of THC and a high level of cannabidiol, so it's not intoxicating. And so it's not like we're giving cannabis to kids and they're getting stoned. But those are some of the most, I think, effective uses of cannabis medicinally, is in treatment of epilepsy and in treatment of migraine. For other things, we do cover some evidence where it reduces spasticity in multiple sclerosis. So there is some evidence that it reduces muscle spasm and tremor in people with MS. So there are some medical uses. It's maybe not as effective as some of the other treatments for those, but it is probably a good drug to have in our arsenal if nothing else is working.